Thank you very much, Ubli, and thank you to all the organizers for inviting us and for this really exciting and extremely timely event. I have been working, as Ubli mentioned, in attempting to create a sort of theory and practice of epidemic forecasting. We started that work in 2012, and starting in 2013, the CDC has been running flu challenges to the community, which, to my delight, have attracted more and more people, such that we started with, I think, 9 submissions the first year, and the last year we did that, which was just before the pandemic, was over 40 submissions. And it's been going quite well. And I think the reason it's been going quite well is because flu is a semi-regular thing, has some regularity to it, some not. There's quite a bit of historical data. It's about 20 years worth of good data in the US. And the most important thing, perhaps, is that it has stable and hence predictable human behavior. People don't change the behavior much because of flu, so you're left to study the behavior of the virus and the immune system. In contrast, pandemic forecasting has not been that successful, both for our own work, but I dare say overall the entire community, and there are many more people who are attempting pandemic forecasting. And my explanation for that is that A, there's very little historical data to build on, and B, and perhaps the most important for this panel, is that human behavior has been extremely unstable and unpredictable. My simplistic view of how you predict pandemics and epidemics has been that there is a virus and it does bad stuff, and then it might do all kinds of bad stuff, and then the government makes wise and informed decisions about what to do about that bad stuff, which humans, the public, adheres to, and therefore the virus's behavior will change. And our goal is to understand this mapping and to then make recommendations of which government decisions would lead to the best human behavior, which would lead to the best outcomes. Well, that was way too simplistic. As we all learned during this year, the reality is much more complicated. The virus does what the virus does with a fair bit of uncertainty, and it influences the government, but the government is highly unpredictable. And we saw all over the world, not just in our country, very, very difficult decisions and dynamics coming into play at the government level, all kinds of governments, federal, local, and so forth. And then there's us humans who don't always do what the government tells us to do. And in fact, our behavior may affect the government's behavior. And of course, what we do and what the government does affects the virus. And this is an extremely complicated and poorly understood process. So to get a handle on it and to forecast pandemics, we really need to bring the human factor into the story, which is something that I know nothing about and I have done nothing about, and we could use all the help we could get. So let me just add one anecdote here before I get to my prescription of what needs to be done. In the early stages of the pandemic, you can follow mobility data that shows that the entire country went into lockdown at about the same time, which is the second half of March, even though government decisions on what to officially lock down varied greatly between states, as you well know, where some states issued their lockdown orders well before these 2 weeks, some states during, and some states after. And yet it seems like people didn't care what the government was saying. Some of them were locking down before the government, and some of them were locking down after the government told them to do that. So they were reacting much more, in fact, to the crisis in New York and the fear that generated than to what the government told them. So this is just a hint of why we need to understand people better. So
Roni,
what do we need?
Can I just another 30 seconds would be great, thank you. And then so I can move us on. Thank you.
30 seconds. What do we need? We need better epidemiological and medical data. I'll talk a lot about that. It needs to be brought to bear faster and to be more uniformly defined. And I added here the directorates that I think are relevant. We need deep instrumentation of human behavior without compromising privacy. We need to talk about that. And there's a lot of engineering that needs to go into that. We need to study the triangle above, which would be done by engineers and computer scientists. And we need to study a lot of behavior change communication, including some real-time experimentation to inform us. Thank you.
Thank you, Roni. Thanks very much indeed. We'll go straight to Latanya, please. You're on mute at the moment.
Yes,
Lovely.
I hate that when that happens.
It happens to us all.
Thank you very much for the opportunity to speak, and it's just a wonderful conference. The role that I fit into this conversation has to do with privacy. I specialize in unforeseen consequences of technology and how to harmonize technology and society, and I've just had a knack at being early to a place, conducting an experiment that exposes the problem and the nature of solutions. And then that puts a light that really brilliant minds follow. So I've pioneered the field that we think of as data privacy. Irby talked about the algorithmic bias work. What many people may not know is I also worked on national biosurveillance systems around 9/11. And most recently on contact tracing during the pandemic. So that's the perspective at which I come to you today. And I put forward to you that the critical issue is finding an optimal way to conduct research and increase scientific understanding, while at the same time using privacy preserving techniques that can make some guarantees. We want to guarantee that the data is both useful and at the same time that we can make some guarantees and promises around the privacy protection. It's kind of easy actually to provide utility. We can just, and that's what this chart is kind of showing. Point A is, look, we can just have open data sharing. And, we believe that we can sort of maximize utility. It's kind of easy to have privacy. And that's what point B is showing. We just don't give the data away at all. And those two data points, A and B, create a kind of false belief that utility and privacy have to be at odds with one another in a way that you have to trade one against the other. And as soon as you adopt that perspective, then you're automatically only going to stay on that line. What we've been able to do with technology and what the goal is of privacy techniques is basically using technology and policy together to find the sweet spot. That's shown here in the graph as point D. That's where I get both the utility and the privacy. There are many examples where we don't do this well. And one of the ways to get to the sweet spot D is you can't regulate it to law or policy, because it's really a matter of the science itself and technology and how you fuse those together. I'll give you an example of how this trade-off played out in contact tracing. Point A on that curve represents the idea of public health just getting data directly. Here in the United States, we really didn't do that. Other countries did. The option B, though, was a stake put in the ground in many ways by Apple and Google. Created a platform very early on that said, look, we're going to do anonymous contact tracing, meaning if somebody comes close to you, your phone will detect it. And if they later test positive, they can push a button on their phone and then that will alert you. The problem is it has no way, like in a very concentrated area, like a college campus, it creates too many false positives to be useful. What you wanted was a human in the loop to be able to vet those particular signals. And so as a result, the Apple-Google solution put their answers on B, which wasn't optimal either. Because they're such big players, contact tracing got stuck pretty much on that red line. However, we've offered some fantastic solutions in D. One of them is tiered access that's been brought forward in the new Evidence Act that became law last year, and selective revelation of data of how when something happens, I can reveal more and more anonymous data because we can actually see or show that an event is happening. We launched My Data Can, thanks to NSF funding, which allows individuals to have control over their data. And we've shown many fantastic ways that data has been able to be shared, either by group computations and so forth. I know I'm out of time. Maybe I'll have other opportunities to share with you some of the other tools and techniques that come to bear. But clearly, this is an area, especially as sensors come online, and those are personal sensors, that we need a lot more work and research in. Thank you.
Latanya, thank you very much for holding in time there. Nicely noted there. Thank you very much indeed. We'll move across to Jeanne, please. Jeanne.
Hey, good afternoon. Hello, everybody. So where I start, actually, I'm in New Mexico, but where I start is 100 years ago in a small Kansas town called Sterling, Kansas. And the year was 1919, And a little girl, 5 years old, named Margaret Ann Fair, died of the pandemic influenza. She was survived by her parents, and she was also survived by her little brother, who was my grandfather, DJ Fair. So everybody on this call, we all have an ancestor that was impacted by the 1918-1919 pandemic influenza. And so, you know, we're living in a pandemic now, and if we jump 100 years in the future, we will probably still be able to say something similar. Somebody in our descendant was impacted by the current coronavirus pandemic. So now jumping into the future and into the next slide, thinking about the future, we're in this for the long game. And so in the last several days, there's been a lot of talk about all of the things that are increasing infectious diseases, such as biodiversity loss and habitat change, the increase in the wildlife-human interface, bushmeat hunting, you know, all these things. But probably one of the most important things is climate change. And so how that's impacting us now and into the future, and how that is impacting diseases, we're already seeing. And so at Team at Los Alamos, we built a team to try to tackle this. So pretty much trying to couple the Earth system's climate models with the epidemiological models. Now, this is a problem that is just messy with scale and data fusion, and it has sort of the complexity of it. And so we're trying to model and bring together and couple several complex systems. So what our team did was actually, we're starting with mosquito-borne infectious diseases, which are, you know, their own complex system. But our goal is to, you know, be able to forecast, 30, 40, 50 years into the future about how can we expect, you know, climate change and other just environmental changes to impact infectious diseases. And we started with the mosquito-borne diseases because we're already seeing this. We already know that mosquitoes are moving north. They're able to overwinter longer. They're able to breed longer. And so that's our vision. And our mission right now is to create this infrastructure to bring together the Department of Energy's Earth systems models with the epidemiological models. And so, you know, we're trying to prepare for the uncertainties of the future, because uncertainties are hard and we're living that today, but we're in it for the long game. So that's my vision.
Beautiful. Thanks very much indeed, Jeanne. Nicely timed there. Perfect. We'll move swiftly on to Alfred. Alfred?
Yes, thank you for the invitation to this extremely interesting meeting. I come from the point of view of information theory, machine learning, statistical signal processing, from the engineering perspective, although I have appointments in the statistics department. And so my experience in related areas primarily is in looking at modeling infectious disease for the purpose of prediction. Indeed, we ran some challenge studies with Duke University over a period of about 10 years, challenging individuals with flu, H1N1, respiratory syncytial virus, and others to look at the evolution of susceptibility factors like stress and other types of environmental factors. So really, when you look at from a data analysis standpoint, the design of reliable pandemic and early warning systems presents really a special challenge that's related to the complexity of the exposome. So how one is exposed, at what time one is exposed, mechanisms at which that exposure will create infection or not. Many people do not get infected, many people do not shed, which of course leads to pandemic. So I focus on three of principal issues. And first is the importance of integrating data sources from the individual level to the population level, as shown from left to right, with molecular to clinical for physiological measurements, behavioral measurements, perhaps also taken from wearable devices, but also at the population level with Twitter and CDC and clinical information that comes from governmental or non-governmental sources. So the issue is that the individual and population variability of the exposome is extreme, and it varies over time and scale, molecular to macro behavioral. And so many of these domains are related, of course, and one needs to perform experiments in order to be able to fuse the data to identify those common factors in each one of these multi-scale domains. And then fusion is basically facilitated by machine learning, which introduces values of information for determining where variables should be sampled, at what points they should be sampled, what variables should be sampled, budget, including privacy and cost, error control for controlling the false positives, and most importantly, in terms of this meeting, domain information, which requires domain specialists to inform us on what types of models are going to be effective in pandemic early warning. So if you could go to the next slide, please. This sort of just gives an overview of the points I've already made for the most part, except for the main issue that I like to point out is from a data analysis standpoint, early detection and early warning of threats is really a novelty detection problem. So we don't have models for new threats, and so therefore one has to formulate the problem quite differently, and quickest detection, methods of outlier detection and so forth have only been sort of scratched the surface on in terms of health and prediction. And so I think that'll be a theme that I'll probably elaborate on as I talk in the breakouts.
Alfred, thank you very much indeed. Much appreciated. Let's go straight to Lawrence. Oh, Larry, I do apologize.
Thank you very much. And I want to thank the organizers, especially Christine and Ubli, for inviting me. And I'm a little bit of a fish out of water here because ProMed that I'm going to talk about is very much a human-driven system that attempts to do exactly some of the things that Alfred was talking about. ProMed is in its now 27th year of existence, and ProMed, which is a program of the International Society for Infectious Diseases, is designed and serves as an early warning system for outbreaks of emerging pathogens. It has served this purpose for that period of time. Is, as I say, a very human-driven system, and all of our work is very handmade. So we need the help of panelists, of the other panelists, to do the work that we do, but hopefully do it better. We don't try to predict, although we work, there's an allied project at ISID led by Dr. Britta Lastman called MRIDS, Monitoring the Risk of International Infectious Disease Spread, that attempts to use ProMed and other data to actually predict how pathogens will spread. But I wanted to divide up what we do into kind of three categories, and they actually are somewhat close to what we just heard about. The first is horizon scanning. We need to keep a very broad view of what might be the next outbreak, what might be the next pandemic. And so we look, of course, not just at human pathogens, but we use a very One Health approach and look at animal and even plant pathogens as potential drivers of outbreaks that affect humans. Of course, they don't need to directly affect humans. Sometimes outbreaks in animals and plants can have major impacts on human populations without infecting them directly. ProMed is open to all sources of information, and so anybody can send us information via email. We mine the web. We work closely with HealthMap at Children's Hospital Boston, Harvard, that does web crawling for us. We use social media, we use notes from our readers, we look at genomic data, we look at all kinds of data. The 40 or so humans that make up ProMed try to mine this data, and it is a fire hose of information. One of the things that makes our lives difficult is being able to sip from the fire hose, be able to find the important bits of information that lie in that huge stream of information that's out there. And so filtering, being able to find that information is really important and really difficult. The processing of natural language is something that we humans do pretty well, but machines have trouble with trying to figure out how many cases are reported or how many deaths are reported in a news story is challenging even for a person, and almost impossible in what we found so far for machines. And finally, pattern recognition, trying to figure out how the pieces fit together, which of these bits of information are important, what trends move together to cause the first signs of a pandemic. One of our editors, Marjorie Pollock, was very astutely noticed that the signals of the early days of COVID, the outbreak, the pneumonia outbreak in Wuhan, was very reminiscent of the SARS outbreak, and she noticed that and sounded an alarm bell back in 2019, the end of 2019 when this was first happening. And so, how can we do that better? How can the humans that work on ProMed learn to better recognize those patterns, and can machines help us do that? But we very much hope so. So what I guess my role here is to ask for the help of those who are actually the data scientists and computer scientists in helping us to do our jobs better, and perhaps in formulating the questions to ask and how to ask them. So I'll stop there and thank you.
Thank you very much indeed. Much appreciated, Larry. And last but not least, John, please.
So our topic this afternoon, data-intensive machine learning and modeling for pandemic preparedness, is a subject I've been working on since 2010 when I began studying a phenomenon called critical slowing down. This phenomenon occurs when a dynamical system, such as an epidemic, approaches but has not yet crossed a tipping point. The hope inspired by that research is that early warning systems might be built around the signatures of critical slowing down. And we now have a reasonably large body of theoretical and empirical research on this topic. Since then, I've done work on Ebola 3 separate times, yellow fever, Zika, influenza, and of course, COVID-19. Of course, much of the weakness of our pandemic preparedness has to do with other things: a weak foundation in data gathering, political will and coordination, cooperation by the public, failure to act decisively. The machine learning and modeling have nothing to offer there. So what do data-intensive methods and modeling have to offer for the future? One thing I believe is that we need to embrace a pluralistic approach. Too often, it is simply assumed that the problem to be solved is one of optimization or forecasting or something else. Other times, it's assumed that some feature of an epidemic is the important thing, i.e. the spillover event, super spreading, age-structured contact, long-distance movement, asymptomatic transmission, and so forth. And then other times, it's assumed that because a model can be made to represent such and such a phenomenon, it will give the right answer. In fact, I think that the problem space for quantitative analysis is often much bigger than those that are envisioned. That's my plea for pluralism. Paradoxically, the individual actual tasks for modeling are often much smaller. My point is that the purpose of any model needs to be made very clear, i.e., is it to aid in decision-making, or is it for inference, estimation? Is this counterfactual investigation and scenario analysis, situation awareness, logistical optimization, risk communication, etc.? The value of any quantitative approach, I believe, is its fittedness to the task. There are many quantitative methods on offer that range from classical approaches like household surveys to machine learning to agent-based modeling to compartmental modeling and so forth. These are not all fitted to the same tasks. I think each is a tool, none of them is a panacea, and if a person tells you they have a model or a method for everything, I think you should run in the other direction. So in 2016, Barbara Hahn and I proposed that pandemic threats be categorized using advisory warnings along the lines of those used by the National Weather Service for severe weather events. Using this conceptual framework illustrates that the operational questions, and therefore the analytical tasks, are different under different conditions. For pathogens under a watch, we've developed data-intensive workflows for taxonomic and geographic horizon scanning, which pathogens are likely to spill over, what animal reservoirs are carrying them, where in the world is this going to occur. I think these analyses are hugely useful for targeting surveillance, but they're useless for containment. Other methods are needed once spillover has occurred. So here's a conjecture. The biggest advances in analytics for pandemic preparedness and response will come from the careful integration of domain knowledge, by which I mean knowledge of the specific sciences of immunology, viral evolution, epidemiology, ecology, and so forth, and statistical or computational methods that allow us to learn new things from data. I see multiple ways in which this integration can occur. For instance, we can develop machine learning approaches to specific questions if they are highly structured by the relevant domain language, but using multi-layer neural nets for generic function approximation isn't going to get the right answer in most cases. Similarly, standard compartmental models are simply too rigid for modeling major events with endogenous behavior change, evolution, changing public policies, etc. I think that was Roni's point earlier. But semi-parametric models can harness information from both the more fixed features of an epidemic, like the incubation period, and adapt to those that are more plastic, like encounter, infectious contact, and isolation. Lastly, we're greatly lacking in cross-sector communication about both the questions and challenges we face and relevant knowledge. That's why we have a workshop this week. To that end, the University of Georgia is also creating a consortium, the Global Infectious Disease Intelligence Consortium, or GIDIC, which invites public and private partners. And so I'll end by saying if your organization might be interested in joining GIDIC, to please reach out to me after the workshop.
John, thank you very much indeed. And thank you everybody on our panel here. So audience, you now know where our panel comes from. You know their perspectives. Now the magic really happens as we prompt them with some questions and see how they interact with each other. And I beg of you again, or just remind you again, if you have questions continuing, make sure they go on the Chi-Storm page, because that's where we can all see those. I'm going to hand over to Ubli, I think, to start the panel off with some conversations. Thank you.
Thank you so much. So this is a very engaged group of people, so I'm hoping they will directly interact and not wait for me to poke at them, as it were. One of the things that has come up multiple times, both in our discussions before and we see today, is this idea of trying to figure out the line between how much model or domain information do we use versus how much we keep unmodeled. So I was hoping that people could make some comments on that. And I think at the beginning, I'll start with Al and then Roni, and then we'll engage others as we move ahead.
Yeah, thanks, Uli. It's a very important question because clearly one requires models in order to reduce the noise and variability that comes from various types of data sets, that they can then be combined and form an accurate prediction. But on the other hand, when you don't have adequate data, you need more models, right? Because you cannot apply a completely non-parametric data-driven approach with so few data points. So that's where the domain specialists from the social, biological, epidemiological, and other areas come into play, and of course sensors also, in providing those models so that we really don't need that we can sort of apply it at a minimum level of leverage the data-driven approaches. So that's my perspective.
Maybe I'll bend the question a little bit, since you've had some experience recently with all of this. What were some model assumptions or integrations that you endeavored to do, say, 6 months ago or 9 months ago, that you realized had to be changed as you collected more data?
Oh, yeah, and that's clearly, I mean, when we were looking at the trying to predict influenza susceptibility, we originally started to look at models that were compartmental models that had been reported in the literature, systems biology types of models that tried to link from a molecular level all the way through to the interactome, to physiological signs and so forth. And those models just were completely inadequate, to be frank, because of the fact that there are so many, let me say, abstractions that go into mathematical modeling. And I'm a skeptic that we'll ever be at a point where we'll have a truly unified, from micro to macro model. And for those interstitial regions where we lack data to connect the different models, that's where we need to have additional experiments, additional openness in terms of data availability to sort of fill in those gaps. There's just too much problems with accessibility currently.
Good. Thank you, Al. Roni, could you follow up with your own experiences?
Sure. First, let me agree with Al completely. As I tell my students, you cannot learn from data alone. You learn from assumptions plus data, and how you trade the two. Let me steal from Einstein. You should make as few assumptions as possible, but no fewer. So that is really driven by how much data you have. And that, as was pointed out, depends on the problem. So you go to try to solve a problem, make certain predictions. You start by gathering as much data as you can, and then you would always need some assumptions, but the more data you collect, the less you need to rely on assumptions, because assumptions can be wrong. Specifically to your question about examples, I was never a fan of the compartmental models of the SIR and SAIR and their ill, because I never felt that that's really a complete story of how epidemics spread. And indeed, in the case of flu, in the 10 years we worked on flu, our method has been non-mechanistic. We looked mostly at the data and much less at stories of how the data was generated, and we were quite successful in that. In fact, the community as a whole, of the several dozen submissions, the non-mechanistic submissions tended to be at the top of performance. That was true for flu. When you come to COVID, you don't have data. You must make assumptions. And in fact, there are many more complicated assumptions, as I pointed out in my opening remarks. Human behavior is a huge one. And so we were found, at least my group, very stymied by doing what we do best, is bringing data to bear. There was not much data to bring to bear. And as a result, I truly don't believe that we provided any meaningful value, with the exception of 2 to 3 week extrapolation, which you could do in many, many methods. But looking a month out, 2 months out, predicting the 2 or 3 waves that we had, why we had them in this state and not in that state, I think we failed miserably in that, because we had neither data nor realistic mechanistic explanation.
So this is a thesis that you made in your presentation, and I want to springboard off of that to bring Latanya and Larry into the conversation, because I think both of you have much more experience with humans and how they interact with some of this. And so maybe, Larry, I'll start with you. And since you have developed so much human-based data collection, where do you feel machine learning can help you with ProMed in terms of balancing the efforts between human-intensive data collection versus automated processing?
Thanks, Uli. That's a tough question, actually.
That's why I saved it for you.
And it's an important one, because I think somewhat facetiously in the comments you talked about, sort of machine-enabled humans, and the interface between people and the machine is really important. When ProMed started, there wasn't really a web. All of the submissions to ProMed came from people who were sending in reports that were part of ProMed. We do still get a lot of information from there. But for example, and this was first actually pioneered by the Public Health Agency of Canada, developed GFIN, the Global Public Health Informatics Network, that was the first attempt to mine the web for infectious disease information. And that was later followed by HealthMap, which also does a lot of web mining. And so being able to sort through a larger amount of information in a shorter period of time and try to come up with hits. But that still needs human processing. There's a lot of junk that comes up, and the natural language and keyword kind of driven searches don't work all that well a lot of the time. And so we still need, I would say, more intelligent processes for sifting through that information, fire hose that I alluded to. And I think if there could be alerting systems that could find that information, and that information doesn't have to be media reports or information on the web. It could also be, for example, viral sequence signatures or patterns of mobility or cell phone usage. I mean, there's just so many potential sources of data out there, some of which we know about and some of which we don't. And to have intelligent machine-driven processes applied to those that could alert us would be a real advance.
Good. So Latanya, you've been instrumental in unearthing the biases that show up in some of these algorithms, which of course are inherently designed by people. And given that we've seen resource inequities at play in real time with the pandemic, how do you think technology can help us overcome some of these inequities?
Well, I mean, in lots of ways, but I just want to back into it, that question by first addressing the prior question. And that is, for the most part, individuals can play a huge part in terms of the information that we capture on them. Everything from Fitbit kind of sensory data to phone information and so forth. The issue about whether or not they'll share that data has to do with technical infrastructures that we put in place that protect them from harms. And that's the number one issue for most people, is their ability to participate in a lot of the research questions if in fact you can make guarantees that no one will be harmed, that they won't suffer from that. And so a lot of the technology structures that we've put together, like the My Data Can structure, or even like the Novid app, which is out of Carnegie Mellon, is a great example where people use their social network. When somebody's tested positive, it basically says, how far away is COVID from me? And so people can literally see a wave coming closer and closer to them. That's incredibly impactful. That's empowering the individual. So one issue is, first, can you protect against no harms? And the second was, can you empower individuals? And I think when you begin to frame data access in that way, as opposed to, just people just sort of throwing data over the wall, you can get incredibly powerful results. In terms of the bias of the way things are unfolding, that bias continues. I mean, everything from an inability for the elderly or people with disabilities to even sign up for the vaccine when they're eligible to get the vaccine. I mean, so just across the board, we have not been good around using technology in a way to even make benefits even accessible.
So Jeanne, going to you, a theme that we've been coming back to is how technologists can impact policy and governmental actions. And in our conversations before, you noted that you had a good partnership with New Mexico Health. And I was wondering if you could talk to us about some of the success stories that you've had in terms of doing data analytics, for a government agency.
Yeah, thanks. So our governor in New Mexico, was great with working with both of her national labs, Sandia National Lab and Los Alamos. She realized very early on that she had two of the top national labs in her state, and pretty much made it an immediate call. And so many teams on both were working with the Department of Health and her office, throughout, and continue to work with them. And so, I think in our previous discussion, I brought it up as a positive, thinking, of course, all states are doing this. All states are reaching out to their academic epidemiologists, and they're working hand in hand and having great meetings. But I think I was probably naive in that. And so grateful to be here in New Mexico, but yeah, it really was a great example. And I think one thing that came from this happened back in 1993 with hantavirus. So I think some of that actually trickled up to now. And so in 1993, hantavirus was here. And again, it was sort of this transformative science event that happened, and then over the last 30 years, they've understood hantavirus at a system level, but I think some of that trust and everything was left over from that.
So is there any advice that you would give the rest of us in terms of insights you've gained from this interaction?
Yeah, you know, so the advice that was given to me many years ago from this hantavirus team. And so there was a Dr. Gary Simpson, who was in charge of sort of the outbreak of hantavirus. He was the first doctor to see the first 2 Navajo young people that died of it, trying to figure out what it was. And he said, if you wait till the first day of an outbreak to exchange your business cards, the pathogen's already won. And so the best advice is just to continue to relationship build and do these workshops and have drinks together and get to know each other and all of those things.
So you've given me a perfect segue to the question that I wanted to address to John. And again, it circles back to comments that people have made. So John, you definitely, I think a number of us have naivete in terms of coming to look at this problem. You've been looking at this for a long time. And to circle back to a comment that Al made, what do we do in the beginning when we don't have enough data in order to take advantage of these wonderful machine learning techniques, and you're simply looking for these abnormalities or outliers, but you don't know how to describe them?
That's a good question. So I agree. I think it was Al who suggested that anomaly detection is an underused tool. I don't think it's the only underused tool, but I think it's something that we can use. For anomaly detection to work well, we also have to have a baseline understanding, which means we have to have information systems that are producing online data on a regular basis that we know what the normal modes of operation are. My point about needing to bring together domain knowledge and data in some structured way, one that in my opinion should be model heavy, has to do with the way in which those data are generated. So look, you've got some kind of system, whether it's an experimental system or it's the world, and it's generating some kind of data. If you have enough data, you can anticipate what future states of that system are going to be, but only as long as the system stays the same. What happens in a pandemic is that the rules of the system change, and that's one of the places where bringing that domain knowledge is really important, whether that has to do with behavior change or the conditions of transmission in a new population or something like that. So, my view is that what we ultimately need are flexible systems that are adaptive and that can assimilate the information that we have from subject matter experts, as well as new information as it comes in. It doesn't get, channel locked into just one set of information or another, but it's able to combine those nimbly and respond appropriately.
That's great. So in my enthusiasm and passion for this topic, I have dominated the questions, which was predictable. So let me hand off to Brian, who will ask our last question of the panel.
Yeah, thank you very much, Jubilee, and for all the panelists who have provided so much insight here. And gosh, there's so much to say, but I really want to, with the current situation we're in now, we're in a situation where we'd like to go back into the near past, for example, and try to reconstruct what were the key issues that were driving human behavior in this instance that created such out of the distribution sort of behavior that has been so key to the way that this pandemic has emerged and changed. But I also want to imagine a future in which we have the data sets that we'd like to have on hand to answer those questions, so that we're not just sort of looking for table scraps from whatever kinds of private entities might be willing to share data or what kinds of data might be available with various sources, but actually taking a proactive approach to this, enrolling people in panel studies that are collecting this in-depth type of information that would allow us to reconstruct the information that people are exposed to, the viruses that they're exposed to, includes biological sampling, and it would be quite invasive, but it would be an opt-in sort of, it would be a kind of an opt-in research design. Is there prospect for thinking about those kinds of models of how we might expand longitudinal modeling to get at these issues and these blind spots?
Brian, who do you think should go first? Oh, sorry.
Well, I'd like to discuss maybe, I mean, I was originally thinking about asking Dr. Sweeney for her input on this, because I think she has mentioned and put her finger so perfectly on one of these major stumbling blocks for a lot of work in this area, which is these balancing of different interests. And imagining a situation like I just described, a scenario like I just described, people would be incentivized to provide their data. And so they might be willing to move their point on that space that you've modeled here in a way that would be extraordinarily useful for researchers and, you know, provide assurances about access to data. But
yeah, I don't even have to respond to that. I can just +1 you, Brian.
Okay. All right.
We could definitely we have models that would encourage people to participate in ways that we can make promises to them that are meaningful in terms of their privacy.
So how about Roni, would you say it, because there's this unknown drivers that are now even more, not just more complex in terms of the flows of causation, but also there's all sorts of types of data that we want to be collecting to try to build some kind of systematic understanding for some of those drivers. Would you see panel studies with a full battery of kinds of sensors and health measures playing a role in future forecasting?
Oh yeah. So we are always dying for more and more data. Sort of paradoxically, pandemics are much easier to study and understand in principle than epidemics, even though they're harder to forecast. And the reason is, one of the hard things with regular epidemics is the very complex partial immunity landscape of the population. Different populations in different locations have different idiosyncratic combination of partial immunity to, say, different strains of flu. When you have a new pathogen, it's a tabula rasa. Nobody has immunity to it, and that aspect of complexity is taken out of the equation. Having said that, everything else, you need to collect the data. We've been doing our part in our team at Carnegie Mellon with COVIDcast. I posted that link. What we've been trying to do this entire year is to capture as accurately as possible as many different indicators of COVID as possible, go beyond the cases and deaths into mobility and people's behavior and how they answer questions to a massive survey that we put out with the help of Facebook. There are many, many other sources of information, and one of the biggest we should mention, and I think there was an article in the New York Times recently by Mina, epidemiologist from Harvard, Michael Mina, who suggested a massive antibody, continuous, as was pointed out here before, a continuous interpandemic, not just during the pandemic, inter and intra-pandemic, continuous survey of antibody responses from different parts of the world at different times. We need that because our eyes are pretty much closed right now to what's happening.
Thank you. Would anyone else like to weigh in on this possibility or provide some thoughts?
If I could say a few things. I think that there's a lot about human behavior and interaction that we'd like to know.
Yeah.
And so this ranges from the interaction between people in their households, children in schools, children out of schools, the interactions of workers in their work environments. My impression is that we have quite a heterogeneous landscape of risk, and we don't know where the hotspots are and where they aren't. And I think that's something that we could learn through careful study. Another idea has to do with sort of borrowing from my field of ecology. Ecology used to be a very place-based discipline. We would set up an experiment in one ecosystem and study that to death. But we couldn't compare a lot across different ecosystems. About 20 years ago, people started setting up what they called distributed field experiments. Groups from around the world would couple their regular experiments, whatever they were doing for their own purposes, with a common but very simple study design that could be implemented in lots of places. And so you would end up with 50 or 60 or 70 field sites with the same nutrient additions or whatever. I can imagine ethnographic studies that are done in the same way, by adding a couple of features to observational data on behaviors that are relevant to infectious disease transmission. I also think there's a role for behavioral economics. What is the willingness to pay to engage in certain behaviors in order to achieve certain outcomes? That's something that we poorly understood, and is one of the reasons why, as Roni points out, what we anticipated the government response to be and the public response to the government, why that was so surprising.
Great. Well, thank you so much, everybody. This has been an incredibly engaging conversation. We've gone way over time, which means that it was generating a lot of thought. And so I'd like to thank all of the panelists for their participation. Really enjoyed it. And thank you all.
Thank you. Thank
Thanks
you,
for having
panel.
us here. Thank you very much.